Hi, I'm Dr. Tanya Elliott, and I'm going to walk you through how to do a physical examination through video. So this episode is going to focus on the abdominal exam. And this is one of the most challenging exams to do through a video visit, and ideally there will be another person in the room to be your hands for you. So that would be a friend, family member, or caregiver present. So as we know, the three most important parts of an abdominal examination are inspection, palpation, and auscultation. So unfortunately, unless the patient has a digital stethoscope, we won't be able to do the auscultation piece. You may be able to teach the patient or the caregiver how to do percussion. However, it would probably be challenging on the other end to be able to hear whether or not there are any differences in the sounds during the percussion. So we're going to focus today on how to do both palpation as well as the inspection of the abdomen. So in order to do a successful visit, you need to have the patient lying down. Now they can be on their bed or they can be on a couch. And then if there's another person present, they can be on either side of the patient. In order to do this effectively, you need to teach the patient both how to do palpation as well as landmarks. So let's start with the landmarks. The easiest landmark for a patient or caregiver to identify is the lower portion of the ribs on both sides. So I ask the patients to feel that lower portion of the rib and walk up so they meet the middle of the chest, and then do that on both sides. I tell them they should feel a notch there. That's the xiphoid process. And then to just go approximately 1 inch below that, that'll be where you ask them to push down and palpate for determination of epigastric tenderness. The second thing you need to teach the patient is how we think about the abdomen in terms of 4 quadrants. So asking them to go right back to that middle of the chest where they just walked up and the ribs met, and have them draw an invisible line straight down right through the belly button, and then across, cutting across just the top of the belly button. And now we have our 4 quadrants. And it's important to walk the patient through this so that you know exactly where they're palpating when you're asking them to palpate. Again, the patient is lying down, and you want to make sure that you have the camera positioned so that you can visualize the abdomen. Shirt should be up, and you should be able to visualize the skin of the abdomen. This is important because you can actually determine whether or not there's any voluntary rebound or guarding present during the examination. You won't exactly be able to feel that unless the family member or caregiver tells you, oh, the patient just tensed up. But you should actually be able to see some level of flexion of the abdominal muscles through the video, provided that it's positioned properly. In addition to that, when you're walking them through pressing down in the epigastric area, right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant, you should be looking at the patient's facial expressions. Are they wincing in pain? Are they flexing any other muscles? Are they flexing their arms? Are they lifting their knees up in pain? And you can document then severity of pain based on that. If the caregiver or family member is pushing on the abdomen, it appears soft, it does not appear distended, and the patient is just kind of sitting there throughout, then you're really not observing any objective pain on the part of the patient. However, if they're wincing, if they're tensing their muscles, if you can see any voluntary rebound or guarding, if the abdomen appears distended, those are all things that you can document well through the video physical examination. So remember, you can do inspection absolutely just as though you would in your office, and you can walk the patient or family member through the palpation piece. I often will tell my patients palpation is similar to kneading dough. So you can either do a one-handed approach or two-handed approach. And obviously the entire time you're watching either the patient do it on themselves, which again is more challenging, or the family member do it, and you can guide them on technique. So again, for epigastric, 1 inch below where they feel the ribs meet. And then for right upper quadrant, it requires a little bit more coordination with the patient taking a deep breath in at the same time that the hands are cupped underneath that rib cage. So again, asking the family member or patient to feel the lower end of the rib cage, ask the patient to take a big deep breath in, and then cup the hands just underneath the rib cage on the right hand side and breathe out. and determining, again, whether or not there's any pain, whether you can physically see the patient wincing, whether or not they're flexing any of their muscles, and so on. You continue on with the left upper quadrant, left lower quadrant, right lower quadrant. Probably challenging for anybody to be able to feel any masses, but if there's any gross abnormalities, they should be able to pick that up. But again, the inspection piece is tremendously important, so make sure that the camera is positioned in such a way that you can visualize the entire abdomen, but certainly you can assess whether or not there's abdominal distension and whether or not the patient is actively flexing their muscles in response to the examination. That's all for now. Thanks for watching.